Hello, my name is Jeff Petersen, Petersen Physical Therapy. We're here today with Dr. Thomas Feil. Dr. Feil is board certified in sports medicine, and he helped treat my shoulder. He's also been the team physician for the Rattlers, the Brewers, the Suns for about 8 years, I think it was. Who else? The Barca Soccer Academy and Bella Vista Academy, which is a really great high school. So I had torn my rotator cuff in December, tried to rehab it, it wasn't getting better. I came in to see Dr. Feil in about February, I think was the first one. And then I finally had some PRP. So he's going to talk about what PRP is, platelet-rich plasma. So I'm going to turn it over to Dr. Feil and he'll talk about what that's all about.
So PRP is something that's been around for a long time. I've been doing it for about 12 years now. And over the years, we start to learn more and more about the performance of how PRP works using a large dose of blood. We draw 120 cc's of blood. We do a double spin. It's very important for the separation of the cells to get a higher concentration. The goal is to get around 10 billion cells to do the job. We find that with the growth factors, cytokines, peptides, proteins, those are the things that actually help heal the tissue. As Jeff was saying, he had torn his rotator cuff, and the supraspinatus part is the main one that normally gets torn when we talk about rotator cuff injuries. As you can see up here on the screen, on the left side is when he came back in March. We did the injection. This was March 24th, I believe it was. And we did the injection. You see the needle coming in. Here's the tear, that black hole there. And then also up here, you can see it started to open up and separate a little bit as we inject it. This was May 12th. We still have a little bit of a small little hole, but you can see how we're starting to fill out. Here, how it's flat. That's because the deltoid is laying down on top of the supraspinatus and it's not healing. So because of those tears, it causes that supraspinatus to flatten out. As we see now, it starts to become more robust. He does have a little bit of what we call bursitis. It's a little inflamed, but that's not uncommon to see that after we do these injections, but the results end up being very good. His range of motion is definitely improved. He's 8 weeks now out from the injection. With this kind of tear, these things can take up to 3 to 4 months, but at the same time, these people get back to their normal health, do their things they want to do, the physical activity back in the gym.
Yeah, and the awesome thing, no surgery.
Yeah, and no surgery, and that's the key part to that. So there's no anesthesia, no downtime for potential infections. So that's what makes the PRP essential. If there's a complete tear, obviously those need surgery, but the ones that are partial tears, this technique works very, very well and very beneficial for the patients.
Yeah, and so it was awesome. My shoulder feels great. I can move it. It feels vulnerable. The interesting thing is when I came in for the follow-up, Dr. Feil did chastise me for not doing my physical therapy, so I will remember that.
As a physical therapist, you should be doing that.
So the thing to remember is to be patient with an injury like this. It takes, I'm 8 weeks out and it's feeling good. That's what we call the subacute phase, is where you're really vulnerable. So you got to keep doing your exercises for the 3 to 6 months and keep protecting the shoulder. Yeah. So I really appreciate your team. Oh. We're going to talk to one of your teammates in a little bit, but and I also appreciate how well you've helped my shoulder.
Well, one of the things we talk about when we do these things too, what Jeff was just adding to, was that when we do PRP, we think of this as being 4 weeks post-op. Mm-hmm. So at that point in time, if you were to have surgery, you'd be 4 weeks post-op. So we're at that point in time in your recovery. So as we put this PRP in there, you start the rehab, staying on track and doing the things you need to do, you can get back to full recovery like Jeff has. And so we like to talk about is a little bit how important ultrasound is, because with ultrasound, we can see the tears, and these are all through ultrasound. You don't have to do the MRIs. You don't have to have a surgical evaluation, because we can see and do everything we need to do just with ultrasound. And Sam here is my ultrasound technician, and she's going to go over a little bit with that with you right now.
Hi, I'm Sam. I'm the ultrasound tech at Dr. Feil's clinic. We do all of our injections under ultrasound guidance, so you can see exactly where the needle's going. So here is a shot of the injection right here in the supraspinatus tendon, which is this tendon in the front of your shoulder. So this shot is with the tendon looking straight at you. So right here, you see the tendon, right here is the needle, and you can see the fluid coming in and filling up the space where the tear is. So this is about 2 months after, and you can see this space right here where there's a hole is filling in. So the platelets work kind of like stucco on a house. It helps everything glue together and creates that environment for healing. Anything else?
Does ultrasound hurt?
Ultrasound does not hurt. It's just sound waves going through. So what it does is there's a probe, and the sound waves go from the probe through the tissue and feed back to the probe and creates this 2D image.
So thank you, Dr. Feil. First of all, thank you for treating my shoulder. It feels great. We want to thank Sam for doing the ultrasound. If this has been helpful to you, please like, subscribe, and share it with your friends.